Every day I run for my life, just like my parents ran for theirs.
I didn't know we were struggling.
I didn't know that life was hard. I didn't know that my parents missed their family.
All of my family is from Mexico, from a small town in Michoacan, and the name of the town is Numaran.
I grew up here in the Roseland district in Santa Rosa. Roseland is a predominantly Latino community. It's very small. There are a lot of migrant families.
There is a big need for people to come back and give back to their community.
My name's Kim Bender, and I'm the Executive Director of the Healthcare Foundation, Northern Sonoma County. We believe that everyone has the right to healthcare and to mental health care, regardless of their age, their race, their income, their health status. 5 years ago, this organization underwent a strategic planning process and identified 3 areas that would be the most effective ways to intervene and improve the health for this community. Those 3 areas are mental health, health access, and early childhood development.
We have just gone from a wildfire to a flood to another massive wildfire and now a global pandemic. And the stress that that creates really takes a toll on anyone, but especially those with young children, those who are non-native English speakers who maybe don't have as much access to the information and resources that are out there as we're navigating these disasters. And so there's a really heavy level of trauma that exists in our community.
Growing up, I knew I wanted to go to school. I knew I wanted to help people grow. I did start off going to the police academy. I decided that was not my route. I decided I want to be a therapist.
The Mental Health Talent Pipeline is a pilot program partnering with local educational agencies who are training mental health professionals. And this program, supported by some very generous local donors to the Healthcare Foundation, recruits students who are bilingual, bicultural Latinx students to help support them over the course of their education, their traineeship, and then all the way 2 years into their first years as practitioners. So when I met Yadi, what really stood out to me was her authentic passion for providing mental health services.
I know in the Latinx community, there's a stigma that if you're reaching out for mental health services, there's something wrong with you. So it goes back to one of my missions in life is that breaking that stigma and normalizing therapy. I want to alleviate suffering where there is pain and where there is suffering. I want to make sure that I can help people put the broken pieces back together and make them understand that, you know, sometimes it's okay to be broken because that's how the light comes in and that's how the flame starts burning again.
I think that is one thing that we've really seen as a benefit of this mental health talent pipeline is that identifying bilingual and bicultural community members who have a lived experience where they understand what our clients are going through.
My experience with the Healthcare Foundation has been advocacy. They have been walking alongside with me.
I have 60 first cousins, and that's just first cousins, and even from my second cousins, I will be the first in my family to have a master's degree.
It isn't just my dream. It isn't just the dream of my family, but it's a dream and a symbol of hope to an entire culture.
One of the things that I love about living here and I love about Sonoma County is how much people genuinely care for one another. And I think because of that interconnectedness and relationships, there is a huge sense of caring and desire to help and support, which is why the Healthcare Foundation, I think, has been so successful and will continue to be.
We believe that everyone has a right to good health care, to be supported mentally and emotionally, and that the best way to do that is to empower communities to support each other.